Nice to meet you all. Welcome. We are happy to be able to share with you who are watching us your working right in the year 2020. It's a pleasure to be at the International Conference on Midwifery and Neonatal Care. Today's topics will be a systematic review of pregnancy and the coronavirus infections, maternal, fetal, and neonatal outcomes. The authors of this article are Cristina Ribeiro Furlan and Sônia Regina Jurado and Kátia Hermes Juliana and Maria Eduarda Pascoaloto da Silva and Letícia Aki Nagata and Ana Clara Freitas Maia, being a biologist, a pharmacist, and 3 nurses. To begin, let me introduce myself. My name is Maria Eduarda. I am a nursing graduate for the Federal University of Mato Grosso do Sul. I am 23 years old, and at the time we developed the study that I will present, I was 21 years old. I am a Brazilian, born and raised in the state of São Paulo, but I went to the state of Mato Grosso do Sul to study nursing. I am currently a nurse at a hospital in the city of the Três Lagoas, state of Mato Grosso do Sul, and I'm doing a postgraduate degree in nursing at the Federal University of Mato Grosso do Sul, with the advisor Cristina Ribeiro Furlan, also author of the study. In postgraduate, my emphasis is on human health, and this study showed me at the time how much I was attached to this area of nursing. Today, I will be responsible for presentation to you the fantastic work right in 2020 at the beginning of the cases of COVID-19. To introduce the study, let's remember about some characteristics of the coronavirus. Coronavirus are RNA virus from the coronavirus family, not cause respiratory and enteric disease. SARS-CoV-1 first emerged in November 2002 in Guangdong province, southern China, and SARS-CoV-2 is a novel type of the coronavirus that leads to an emergent infection disease with notable young involvement and emergence in China in December 29. Both SARS-CoV-1 and SARS-CoV-2 are transmitted by infected respiratory droplets via aerosols and contact with contaminated surfaces. And pregnant women are particularly susceptible to respiratory pathogens and severe pneumonia due to immunological changes and psychological adaptations during pregnancy, such as an elevation of the diaphragm, increased oxygen consumption, and edema of the respiratory tract mucus. Therefore, pregnant women are a risk group for morbidity and mortality from the coronavirus. The SARS-CoV-2 pandemic has produced stress and anxiety in pregnant women in different parts of the world. Worry and stresses in pregnancy are associated with side effects such as preeclampsia, depression, and many other symptoms, with low Apgar scores and baby birth 80. COVID-19, about 80% genomic similar to coronavirus 1, and therefore the pathogens of COVID-19 infections may be similar to that of SARS-CoV-1, as well as the low risk of vertical transmissions in pregnancy. Given the genomic similarity in both viruses, we will present in this study the main matter, fetal, and neonatal clinical outcomes of pregnant women who had SARS-CoV-1 and SARS-CoV-2 during pregnancy. The study demonstrated the clinical outcomes of COVID-19 during pregnancy and delivery. Therefore, it is very important to identify clinical symptoms of COVID-19 infection and affect pregnant women compared to non-pregnant women and to assess their impact during pregnancy and on the health of the newborn. Thus, the present study aimed to describe clinical outcomes during pregnancy in women who had SARS-CoV-1 and SARS-CoV-2 and their impacts of fetal and newborn health. For this study, the systematic literature review method was carried out in March 2020 in an independent double-blind manner by two experienced researchers, including publications for January 1, 2003 to March 31, 2020. And the guide questions was: what are the maternal and newborn clinical outcomes of women who had SARS-CoV-1 and SARS-CoV-2 during pregnancy? A systematic review was conducted using the CAPS portal of WeJournal, Google School, Linux, and PubMed search engines. In this study, as inclusion criteria, we used articles published in the journal indexed in the search sources mentioned above, works available in full electronically, published in the English language, described works, experimental, observational, retrospective, case controls, case studies, and letters to the editor, with containing at least two describable in the title or abstract and with answer the question guild. Articles were included according to the key items for the systematic analysis and meta-analysis. And duplicated works were excluded. Tests not available in full, works in language other than English, bibliographic reviews, meta-analysis studies, dissertations, works that did not fit the time and tools that did not meet the temporal limitation. Now, I speak about results in the article. In this framework, we can observe the results of the review carried out in which identification priority 300 and the rating for studies were depicted in Google School, 10 in CAP Journal, 9 in Linux, and 19 in PubMed. Aside from the screening, we first selected 61 studies after reading their titles and abstracts, and 12 studies were excluded because there were duplicates. Now, this framework, in terms of eligibility, only 49 studies were selected following the inclusion criteria, and 22 were excluded because not meeting the inclusion criteria. And finally, 27 articles were included in the literature review. After reviewing and reading the selected articles, we can observe some results, such as the mortality rate was higher in pregnant women with SARS-CoV-1 than in SARS-CoV-2. The most reported symptoms in pregnant women with COVID-19 were fever and cough. And Most studies showed negative tests for SARS-CoV-1 and SARS-CoV-2 in newborns of infected mothers. Both types of infections caused intrauterine growth retardation and respiratory problems in neonates. Still, we can observe other results, such as the most common signs among newborns of pregnant women with coronavirus were premature, low body weight, and non-respiratory heart rate. In smaller numbers, there were other clinical conditions such as positive tests for coronavirus, shortness of breath, respiratory distress syndrome, itch with 4 cases, international perforation, necrosis enterocardialis, rashes and right IgM rates, each with 2 cases, and cardiac discomfort such as tachycardia and bradycardia. Thus, after the results found, we can observe in the literature that SARS-CoV-1 and SARS-CoV-2 infections share common clinical features such as fever, dry cough, dyspnea, pneumonia, and admission to intensive care unit (ICU) for mechanical ventilation. Although vertical transmissions of coronavirus disease-19 is not reported in the literature, IgM levels were found in blood tests from infants of mothers who had SARS-CoV-2 during pregnancy. The clinical manifestation of pregnancy patients with COVID-19 can range from asymptomatic cases to more severe cases, requiring medical ventilation, organ failure, and sepsis. The case study by Lee et al. Detected mild symptoms such as cough, chills and fever in the patients or whatever. It identifies pulmonary infiltrates. 18% of COVID-19 infections are mild or asymptomatic. 15% are severe and they require supplemental oxygen, and 5% are critical, requiring mechanical ventilation. Chest computed tomography (CT) is very useful for the clinical detection of the SARS-CoV-2, including in pregnant women. Of the study focus of pregnant women with SARS-CoV-2, one stillbirth was reported. A study in Hong Kong in 2004 showed that SARS-CoV-2 during pregnancy is associated with rising rates of miscarriages, premature births, and intrauterine growth retardation. And this study by Wei et al. That involved 30 pregnant women, 14 confirmed, and 60 suspected for SARS-CoV-2 detected 20% of low body weight in the children of mothers with confirmed disease. The drug treatment of pregnant women with SARS was the use of biotics before delivery and antivirals, preferably in the periperium. In 2003, one of the most commonly used drugs to treat pregnant women with SARS-CoV-1 was Ribeiro. However, this drug was an embryocidal effect in mice, and this may have caused spontaneous abortion in the study by Wong et al. Thus, more studies are needed to better understand the clinical conditions of the newborns of mothers who had SARS-CoV-2 during pregnancy, especially in the first gestation trimester due to the period of embryo fetus organogenesis. Now, the literature pointed to more serious clinical outcomes for pregnant women with SARS-CoV-1 such as miscarriage and maternal death. Whatever, COVID-19, due to its pathogenic potentials, can cause adverse effects such as pneumonia, respiratory failure, multiple organ failure, and even maternal death. In addition to promotion intermittent growth retardation, heart rate, not restoring low birth rate, cardiac irregularity, and respiratory problems in newborns. We concluded your study with the certainty that more research is needed to better understand maternal, fetal, and neonatal clinical outcomes of SARS-CoV-2 during pregnancy to contribute to the precautionary principle and therapeutic decisions of the infections. And we know that this article published in was like a closed curtain for the possible symptoms that COVID-19 could bring to pregnant women and their newborns. We believe that this research was and is necessary for the new findings in the literature in today's years. Here, I leave some references used in your article, beginning from 2016 as the first, and from 2020 with the second and the third. And here we have some more references, such as the 40 and the 15 held in 2020 and 2020. And the 6th that was held by CDCP also in 2022. And finally, I would like to remind everyone who COVID-19 was and still is a deadly disease around the world, with always many women, pregnant women, and their families, as it is not yet known what proportions of the disease symptoms are in the newborn. This study was carried out at the beginning of the COVID-19 pandemic, and it is necessary in the moment we live today to carry out another study. Your study at the time had limitations due to the lack of information about COVID-19, but it is served as a basic for other current studies. I would like to thank everyone for the attention and invited you to see your work in its entirety. It was a pleasure to be able to present at this event and to share with you the findings of your study. A great event for you. Thank you all for your presence and your participation.